medical researchers in Tanzania have uncovered an increasing danger to children.
The last decade or more, we've benefited from a large international investment in malaria research with ambitious targets to reduce the burden of malaria in Africa. And this has largely been successful in many areas, although by far there are many exceptions. This has presented a number of challenges, including diagnostic challenges of fever. So where previously most children and even adults actually had malaria, now we find that in many areas they don't have malaria. And this has led to an important challenge for us to identify alternative causes of feverish illness and most appropriate treatments.
This is Makaa Dispensary, one of our trial facilities. We introduced the rapid test because most of our facilities, they don't have the microscope. So we introduced the rapid test so that they can use them before giving anti-malaria.
The Kilimanjaro scientists and their colleagues from the London School of Hygiene and Tropical Medicine hope their rapid diagnostic test will make sure each patient has the cause of any fever correctly identified so they can get the right treatment.
So one benefit is that we treat the right thing, or we have the right diagnosis. We don't treat people that they have malaria while it's not malaria.
Many patients may have malaria parasites in their blood, but don't actually suffer from an illness that is malaria. And many of these patients may have viral or even bacterial disease. And we find that the pattern of illness is difficult for an individual doctor to tell apart. But taken as a group, we can know that bacterial disease is actually a more fatal illness than malaria and is frequently missed and mistaken for malaria. So there's a big challenge now to make the diagnosis of bacterial disease and treat it appropriately with the right drugs.
So far, the health workers are doing well because most of the cases which are tested negative, they are not given anti-malaria and they are treated for something else. So we hope that for the future, they will learn that not all fevers are malaria, but there are other causes of fever. So they have to look for those causes of fever.
The benefit is that nowadays we don't misuse our drugs. We use our drugs correctly. That's one benefit. But again, we give the right statistics.
People are surprised at how low the incidences of malaria, are really enjoying learning how to use the rapid diagnostic test. The reason that it's challenging is because patients are so used to the fact that any febrile illness is malaria. And so really we're working on, in collaboration with the health workers, to help them to be able to have the conversation with the patients, to bring everybody to the understanding that actually there are other causes that we need to look at.
From the foothills of Mount Kilimanjaro in Tanzania, I'm Sarah Maxwell.